When I joined as an MBBS student, that time I was like a below average student. I was not even in the top 3 or top 10 even. Like gradually, because of that note writing, I told you, I got the crux of writing an answer for any question. But they used to make fun of me. Rebecca, what are you saying? You're one of the best students here. Then the $1 million question is why I joined biochemistry.
We are very thrilled and proud to welcome one of the most revered faculties in whole of India, the most beautiful and elegant Queen of Biochemistry, Dr. Rebeccajames. Hello, ma'am.
Hi.
Welcome to our show.
Yeah.
You're one of the first faculty members to feature in our Thinking Outside the Box YouTube series.
Yeah.
So, my first question to you is, how do you see yourself as a doctor, a teacher, or an academician?
Yeah, I think it's a very simple question for me because I always like to be called as a teacher because the word doctor itself means to teach. So there is a teacher in a doctor. So, and moreover, teacher is an academician too. She's a mentor, she's a role model, and she's a lifelong learner, I think. So combining all these things, I always like to be called as a teacher. And the teacher is not like just imparting a knowledge. I feel always like to be a teacher is inspire the generation. And I think I'm not saying that I'm 100% successful in it, but to an extent I'm successful in that because now whenever I go for a conference, I meet so many biochemistry PGs who come to me and saying that, ma'am, I took biochemistry because you inspired us.
Oh.
I think almost 70 to 80% of biochemistry PG students in India is taking biochemistry, inspiring by me. I don't know. I'm just as ordinary person, an ordinary woman, a family person, a mother. I have all the roles, but being a teacher is the one which I always treasure because I have a whole set of students in India. So I always feel proud to be a teacher because the doctor is a teacher only.
Thank you, ma'am. That's a beautiful answer.
Yeah.
Ma'am, you were not an average student. You were the third university topper during your undergraduate days. You were first in Kerala PSC examinations, and you have several other accolades to your achievements as well. So, I just want to ask you, why did you decide to choose this very unconventional path of choosing biochemistry as your PG? What is the reason behind this?
Yeah. It's a very simple question. At the same time, the answer will not be that simple for me. The story should start way in 1998 when I joined as an MBBS student. That time I was like a below average student. I was not even in the top 3 or top 10 even. During my first year, I was a below average student. But like when I started or during the journey of medico, you are well aware of it. I used to make beautiful notes, crisp and clear notes. So that notes, like most of my friends wanted my notes because I used to make it even a very complicated topics. I used to make a very simple bulleted notes, which is like I had that art of that. Then my friends used to hear from me whatever the teacher teaches in the class. After that, I used to teach them, and they used to come to me so that I love teaching, and I used to teach the complicated pathology, microbiology, parasitology, and all to my friends because I liked it. Then like gradually, because of that note writing, I told you, I got the crux of writing an answer for any question. I understood that there is no point in writing too many things when a question is asked. So it should be clear, crisp, and to the point. And it should be full of diagram. That was not so easy for me. That's why I don't like anatomy. Even now when I take class, when I draw a liver, just a triangle only. So the diagram part was so difficult for me. But apart from that, the content that I used to write in the answers was like getting attracted, and moreover attracting the teachers' attention when they give marks to it. So that art I had, and I had that inborn talent to teach. So I was pretty sure that I want to be a teacher. Okay, so when I did during my final year and all, I told I got how to write an answer. I got that skill to write an answer. Then my marks started improving. I was below average. From the below average, I came to top 10. And in the university, I had never had any like a topper in previous university exam. I was never a topper. But final year, I got the third rank in the university for final year part 2 exam. It's only because I know that I had that art writing skill, note making skill. Okay. So when I used to have chit chat with my friends, I used to say that I want to be a teacher and I want to take a preclinical or a paraclinical subject. I used to say that time itself, but they used to make fun of me. Rebecca, what are we saying? You're one of the best students here. No best students will take, that is.
I can really imagine.
Yeah, that's the usual trend that is having.
Yes.
Being a doctor itself, we always feel that you have to hang a steth around your neck, right? So, but I know that I was never, I don't like it. Moreover, there is a personal problem with me also, because whenever I deal with patients, I was a very soft-hearted person.
Okay.
So whenever I used to talk with them, especially if I see somebody of my age, like small children and all, that stress was like affecting me a lot. And I know that dealing with patients won't be a good career for me.
Okay.
But I want to deal with doctors. I want to teach doctors who deal with a patient. So I thought the other way around, like not directly dealing with the patient, but why not teach the doctors who deals with the patient? So that was my view that time. And after internship, after my marriage, I came to Calicut. Then I wanted to go for a job, but I told I never liked to be practicing or like RMO like job. I didn't like. But I never had any choice because I tried to get as a provisional lecturer. I want to join in Calicut Medical College, but I attended the interview also, but they didn't take me for the first time. Just after my marriage, I think 1 week before the marriage, I came here to attend the interview for the provisional lecturer, but they didn't take me because I don't know why.
They are lost.
I don't know why. Maybe that time, most of the like the medicos, they want to join as provisional lecturer in a non-clinical department, like pre or paraclinical department, because they want to study. Because they'll get time to study from there. That was their thought. So they want to join. There was like a huge rush to join as provisional lecturer in a preclinical subject.
Right.
But I really wanted to join because I want to take...
Because you were passionate.
Yeah, I was passionate and I want to join. That was my view, but they couldn't understand that I really am loving or I'm passionate about taking or not biochemistry. I didn't have in my mind that time anything about biochemistry, but I want to teach. Then I joined because I didn't get any job. I told my husband was working in palliative medicine. So I thought like go with him. They give me a job. that time. There was a vacant post there. I joined as a junior house officer. That's what they say.
Right.
I joined there as a junior house officer with my husband. So at least I'm with him. That is the only thing that inspired me to join palliative medicine. Then during like my tenure in palliative medicine, there is a course in palliative medicine called as BCCPM. My husband was doing BCCPM, and with that batch, Dr. Parvati Warrior, she was our principal, vice principal of Calicut Medical College. She joined that batch, and we met each other. I think that was a turning point in my life because I communicated with her. She is like a biochemistry. She was an HOD of biochemistry in Calicut Medical College, and was a vice principal of Calicut Medical College also. So we met that time, and that was like I told you, right? So it was a turning point in my life. She told me that, Rebecca, I will try to get a job for you in Calicut Medical College. So because of her interference, I could get a job as a provisional lecturer in physiology department, because biochemistry there was no vacancy. Then the $1 million question is why I joined biochemistry, right?
Yes.
So while I was working in physiology department, I used to go to biochemistry department and see my mentor, Dr. Parvati. I have seen her teaching her PG students, and I have seen her in front of the research lab dealing with the clinical samples, patient sample and all. But in physiology department, I couldn't find any patients coming. But at the same time, when I went to biochemistry, I could see patients coming, samples coming. They are dealing with that. I have seen the teacher, the Parvati madam, teaching her PG students that time. And I got inspired. I thought why not biochemistry? It's not like it has something to deal with the patient also. Directly not with the patient, but still there is a clinical touch over there. Even though physiology, you think that it is a clinical subject, definitely it has lots of clinical correlation. But my mind was like a bit more towards the clinical samples and all, dealing with the patients like that. And I have seen my madam who always inspired her students. And then another question you may be asking, then why not pathology? And microbiology.
Yes,
sure. Microbiology, I never liked that subject. It's not like I'm not saying that those who are a microbiologist, I'm not offending you in any way. But for me, it's my personal choice. I didn't like it. Then pathology. Pathology was my favorite subject.
Okay.
Subject-wise, if you ask me, pathology was my favorite subject. But I had a phobia. That phobia is I am very fearful about the microscopes. Without dealing with microscopes, there is no pathologist.
Yes.
And I remember the days that whenever the spotter is coming, like for the first year histology and for the pathology, if you ask me how I identified those smears and all, I don't know. Even now, I don't know.
I can relate to that.
It's so difficult for me to identify any tissues using the microscope. Growths, I was very sure. Like if you ask me growth, I'll answer. But microscopic slide was like something which always I'm fearing. So because of that phobia, I was pretty sure biochemistry is my subject. Next year, I was doing my PG entrance also that time. Then that time also biochemistry was taught by Parvati madam, my favorite teacher.
Yes.
Then that year I got rank of 534. I have all the choices in front of me. I could take pathology or biochemistry or physiology, pharmacology, any subjects which I wanted. But I took biochemistry because of Parvati madam.
I think you're very lucky. Not everybody is lucky to get such a nice mentor, and you're talking very lovingly about her.
Yeah. And last year we lost her. It's like a big loss.
Okay, I'm so sorry.
But still, the thing is like she inspired me. She brought me to the field of biochemistry, and the biochemistry that is living in me is like a part of her only. And
Oh.
whatever she has given me, I could like spread all over India. The module that I have created in biochemistry is now being followed by every student who's taking biochemistry and who's teaching biochemistry. Whenever they want to teach a biochemistry, there are students of me who took biochemistry and completed biochemistry now, go back to my lectures, hear the lectures before they go to the class. So whatever module I have created for biochemistry is like what my mind, what I have in my mind is like, it should not be a subject as you think like test tubes or cycles only.
Yes.
It's not Krebs cycle only. Biochemistry has its it has its application everywhere. Lifestyle disorders, whatever we are seeing and facing now, it's like a metabolic disorder. The name of NAFLD has changed to a metabolism associated steatotic liver disease. So everywhere what you see is like the problems with metabolism. It is not only the inborn errors of metabolism. Metabolism, the cell, is the root cause for everything.
And that's
So
coming
it.
from the cell teacher herself.
Yeah. That's why I took the name the cell teacher.
Yes.
I never took the name cell doctor.
Yes.
I am the cell teacher.
That answers our first question as well,
Yeah.
isn't it, ma'am? Yes. Ma'am, to have a clear conviction like you had when you chose biochemistry and then excel in it is a bold decision. So, what advice do you want to give to the young medical professionals who have an unconventional path in their mind? What can they expect of this journey?
Okay. So I'll tell about the challenges that I faced. The decision that I have taken to take a non-clinical subject is like, that time when I did biochemistry, I was the only biochemistry PG in the entire state. No other colleges, there was no biochemistry PGs anywhere. I was the only biochemistry PG in that year. So definitely it is like a different path I took. So the first challenge I had to face is like, I told my friends used to make fun of me. It's not like their fault, because that is the usual trend that after MBBS, you should join a clinical subject and you should hang the step around you. That is the usual thoughts and the norms that the students are having. I'm not against it. If you had that passion for that, definitely you have to take it. I'm not like saying that you should come in my way. It's not like that. So the first challenge I faced was criticism from the parents. Then my father used to ask me, if you want to go to MD biochemistry, then you could have taken MSc biochemistry also, right? Then why you have to go this MBBS route and coming to MD biochemistry? It is, and nobody will accept you, because all the general public, if I am saying the word I am a doctor, definitely they'll be asking you, which is your PG, right?
Yes.
Then I'll be saying biochemistry. Oh, so you are a tutor, and they are thinking like, I don't even have an MBBS. That is the biggest challenge that I had to face. I'm not saying that I can close the mouth of all those who criticizes me. It's not good. There is no point in throwing stones at every dog that barks at you. The thing is like, your life should prove it.
Yes.
Your life should prove that you can be successful by taking the route or the path that you are passionate about. So definitely the first challenge is criticism. So the answer also I told you. To face the criticism, don't throw stones at every barking dog. Just leave it. Your life will be a proof, because if you're passionate about something, you will be successful, because passion is the generation of a genius. It is the generation, or it is like the birth of a genius. So if you're passionate about it, you truly take that, then success will come. Definitely it will come, because you can put your signature in that. You can put your signature in that subject. So first thing is definitely criticisms. The next is like, when you want to be successful, if you ask to everyone, every successful person, if you ask, what is the secret there is of your success? There is no shortcuts for it. Hard work, sleepless nights. I remember, like, when I gave my manuscript to JP, they were not pretty sure that a biochemistry book will hit the market, because before, what we had was a book called SARP or something like that. You may not be aware of that book. There is like a SARP series for every subject, and biochemistry was like the least sold book. SARP series. But JP, once they saw that manuscript that I have given them, like, they was like, that manuscript attracted them a lot, and immediately they accepted my request, and they were ready to publish the book. So definitely that was not a single day work. It was like day in and day out. I had to work. I have to sit in front of the laptop. That was the first laptop that I bought after doing my PG. During my PG years, you don't even imagine. I don't have a laptop even.
It's hard to imagine.
I used to do my thesis in LRC.
Okay.
Yeah, I had to go, because there is no personal laptops. Few of them are having, but I didn't have, because I didn't have a personal laptop. So after my PG, when I joined a medical college, then I told you, after my PG, within 4 months, I got a job as a assistant professor. Then the first thing I bought was a laptop.
Wow.
Okay. So I used to sit in front of the laptop day in and day out, and I was not like a free bird that time. I was a mother of a kid. He is like was a prematurely born child, and he had difficulty to start writing and all initially, class 1 and all. So at home I have to sit with him, and after he sleep, again I am in front of the laptop. My husband was also working. He had no time for me, but he used to inspire me a lot. I sit in front of the laptop. I made all the diagrams. At that time, nobody knows how to write a book, and even I don't know how to write a book.
Yes.
But I try to find clinical application in my subject everywhere possible. To pediatrics, for medicine, I took points from there, and I connected to biochemistry, and I have made that book. So you can see clinical correlation everywhere in my book. It is not like an ordinary biochemistry book that you have learned in your first year. So it's like a hard work only. I have nobody to teach me that this is the way that you should write a book. So it all happened like that. Really hard work. So definitely you have to face a lot of challenges, but you have to work hard day in and day out, and definitely that will give you the real fruit, and the life will prove to the world that your decision was right. And the last thing what I want to tell you is, whatever decision we make in our life, it should not be under the compulsion of your parents, in-laws, not even your husband. It should be your own heart. And my husband never tried to impose me that you should take this. Whatever you desire, you take it. And he was like a backbone for it. Till now, even now, whatever I am there in front is only because of the backup that my husband is giving me. You can see me in front of the camera. You can see me in front of lots of students. Around 1,200 students I used to teach for entrance. But so when I'm standing there, it's because my children are being taken care of my husband. There is no ego between us. So it is purely his, what you say,
His
his
love
support.
and support.
Support is what made me. Otherwise, I don't think I'll be just a teacher in a college. Not more than that.
It's
So whatever I am is because of the support that he has given.
behind every strong woman, there's a
Yes.
strong man. Yes, I am so thankful for your very supportive husband for enabling you to do this for us. I just quickly want to tell our audience, Rebecca ma'am is my professor since first year of MBBS. And when you talk about the clinical correlations, I get that. Her slides were amazing in biochemistry class. It was always so colorful, so nice and fun to see. And yes, this is the best way to teach, ma'am. While you clinically correlate something, it reinforces our memory and it becomes interesting. That is how you can make biochemistry interesting, isn't it, ma'am?
Yeah, yeah.
Do you get that feedback a lot from your students as well?
Yeah.
Yeah.
Because definitely after there are students who are doing currently pediatrics PG and all, medicine PG and all.
Okay.
So they used to come and they used to tell me, ma'am, like, as you have made a solid foundation for biochemistry, usually it is not so difficult for us to learn pediatrics, not so difficult for us to learn medicine, because that solid foundation with clinical correlation will make a huge lot of changes in the way that you see the clinical subject. That's it.
Now let's dive deeper into the non-clinical subjects. So I want to ask you, what future do these careers hold when a medical professional is interested in choosing a non-clinical subject as their PG? What can they expect? What is the future, ma'am?
So the usual thought is like, after taking non-clinical subject, you be a teacher in a college and be satisfied with a 9 to 4 job. That is the usual thought that we all have about a non-clinical subject. But when I took biochemistry, I told you, it's purely because my teacher inspired me. But when I started my job in biochemistry, I was not sure what are the ways in front of me. This teacher, I told you, the biochemistry teacher, the Parvati ma'am, she used to tell, she used to told me that you can take genetics. But what happened to me is, like, after completing my postgraduate, I was into teaching, entrance and all, so I couldn't get time to do a DM. But there are options. There are options in front of biochemistry. If I'm saying about biochemistry, like after biochemistry, there are options to join DM genetics. So once you complete your DM genetics, you are like a genetic counseling is the main thing that you have to do. It's like a practicing clinician only. I have one of my students, one of my junior in my college, who took DM in genetics. And I don't think it's DM in genetics, postdoctoral certificate course is there in clinical genetics. It is available in CMC Vellore. So she took a PDCC in clinical genetics. Now she is like a roaring practitioner in here in one of the private hospital in Calicut. She has lots of patients. So after biochemistry, there are options that you can be a practicing clinician also if you took DM in genetics. Then postdoctoral courses, like there is a DM called as metabolic medicine. So there are students who are taking metabolic medicine. In AIMS, Rishikesh, I think, there is DM genetics. So not genetics, metabolic medicine. So there are options, like you can join for metabolic medicine. And for pathology, I don't have to say, there are lots of options after taking MD pathology. You can take hematology. Then lab medicine is open for everyone, I think. Lots of options are there after biochemistry. If you want to be a doctor, practice like a doctor, that is also possible. And in anatomy, I'll tell you a different way one of my friends have taken. She joined embryology. Now, once you take the postdoctoral course in embryology, then you are a part of the infertility clinic,
Okay.
like an infertilologist, embryologist. Embryologist is like something that is must wanted in a infertility clinic. So you can be there also, or you can do a PhD. If you are too much into research kind of thing, you can do a PhD also. Then I have seen like this DM genetics, it is not only for biochemistry or pathology or any non-clinical subjects, pre or paraclinical subjects only. Everybody can take DM genetics. Now the thing has changed. Like from the bedside clinic, it is now going to the molecular level because we want to give our patients the precision medicine. The knowledge of precision medicine comes with the knowledge of genetics only. So we are going actually back to the root. Do what you think genetics as a non-clinical or something like that. We have to go back to the roots so that you can be a precision, you can practice precision medicine. That is the future. Not only by the bedside clinic, you have to go through this nuclear pore, you have to go into the genes. Then only you can pick out what is called as the precision medicine. It is the future. So I would say that even if you are a practicing doctor, you go back to the roots, you take a course in genetics. It is a must for every clinical subject. Then only you can give your patients the best, because precision medicine or patient tailored medicine is the way that we have to evolve ourselves. So I will say that not only non-clinical, pre and paraclinical subjects take genetics, everybody should do it. At least 2 months course you do in genetics. Then the perspective that you see a patient will be different. I think that in future, they'll be carrying the genome card.
What a brilliant insight, ma'am. I think this is very useful to anybody who is wanting to reach top position in their field. I think this is a must-have advice, ma'am.
Yeah, that is it. I feel like that only. Once you have to come back to the roots, then you have to flourish yourself as a clinician. Then they will be the best in the world.
Yes.
And you can be different also, I think. Not like others. After MD pediatrics, if you took genetics, then you are a pediatric geneticist. And you don't have to take all the cases of pediatrics and all. You will be focused only towards the pediatric geneticist. Then you will have a work-life balance also. Okay.
The much needed work-life balance.
That is very much required now, right? All are saying about the struggles that they have to balance the work and the life. It's very struggling phase in everybody's life. So you find your pocket, and back to the roots is the only way that you can be unique.
Ma'am, our series Thinking Outside the Box aims to help young medical professionals realize and understand a path beyond the conventional path available to them and utilize support to reach there. So I just want to ask you, nowadays, since many medical professionals aspire to go abroad to pursue their studies, what advice do you have for them?
Going outside, going abroad to pursue their career, I'm not against it. If you want to pursue your career outside the country, definitely you should go. But at the same time, we should also understand that our country also needs the brains like you. So if you want to be a different clinician in India, you can, I think there are all opportunities here also in our country to practice and to pursue their career, to be a successful doctor. It is there in our country itself. But at the same time, if you desire to go out, you can go out. You can go out and the country and practice. But at the same time, you should be giving some contribution to our country also. That is what, like a research you can do. Even if you pursue a career like outside India, you just do a research among the community in India. Good studies, good researches, your contribution to make a change in the way that we practice, that you can do. So that is my answer to that question. Don't go completely away from the country. You have the roots in our country. You give your contribution to our country also. That is enough, I think.
Yes.
It is not always necessary that you practice here and give your contribution here. You can go out and give some contribution, which where there is a signature of you to our country, that you can do, because you are all highly talented doctors, and you should be a researcher also.
Yes.
In that way you can contribute your country, is what I feel.
Yes. Ma'am, that brings us to the end of today's session. I really don't want it to end. It was beautiful talking to you, and I'm very sure that our audience could relate a lot, and they were so much inspired by your insights. So finally, I have something to say. There is a saying by Longfellow that goes like, the lives of great men all remind us we can make our lives sublime and departing, leave behind us footprints on the sands of time. That is the saying that kept replaying in my head when I was listening to you. Life of a great woman. I am so happy and proud as a woman to sit here talking to you. And yes, you inspire me a lot. And I'm so proud to say you're my professor. Thank you so much, ma'am, for coming here and giving us your time. It's so much
appreciated. Thank you so much, and I should thank Dr. Krishnendu also. She's my student. More than a student, she's my friend. I always call my students my friends, because I used to interact with them like that. So even if I am sitting here as a talk show, I never felt like I am in a setup like this. I was just pouring my heart to you. So that's how I feel. And thank you so much for giving me this opportunity to reach out to other students who wants to hear from thinking out of the box.
Yes. Thank you, ma'am. Thank you so much, and all the best.